All right. Hey, everybody. I hope you guys are having a good day. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to go through hip pain relief exercises. We're going to do 3 of them. I'm going to show you in a couple different positions. So let's just say, first of all, if you have hip pain and it's not diagnosed, you're not sure where it's coming from, that's really the most important thing that you need to do is figure out exactly where it's coming from. And we offer free consultations. All you have to do is call our office at 215-997-9898 and we'd be happy to get you in. But if you want some stretches, we're going to go through a couple of stretches. So we're going to kind of work the whole hip in these stretches. These may bother a knee, these may bother an ankle. If it bothers another body part, don't sacrifice that other body part. Just skip that stretch and move on. These stretches should feel good. They should not hurt. So if it's something that hurts, or it's causing numbness and tingling, or it's increasing your pain, or it's increasing your pain in another body part, you want to stop and consult your medical professional. This is not something that should be painful. This is not something that should cause you any additional pain. All right, so the first one we're going to do is actually in standing. We're going to do 1 in standing, 1 in kneeling, and 1 in sitting. So the first one is going to be just a stretch for the inside of your legs. So you're going to start, you're going to spread your legs, not too far apart, but just far enough apart. And then you're going to bend one of the knees. Now, for this stretch, you want to make sure that your toes are pointed forward. All right, your legs are straight until you bend the one knee. Now, you don't want your hips to turn. You want to keep everything straight and just bend that knee. You should feel a stretch on the inside of your leg. Now, if you don't, you can take this leg and you can prop it up on a step. I don't have a step here, so I'm not going to show you how to do that. But you just want to take this and do nice and easy, just a nice and easy stretch, sinking all the way down until you feel it. Just keep pushing your butt back until you actually feel the stretch. Now, a lot of people will start to do something funky where they're all the way down here like this and they're more bending over and trying to get a low back stretch than they are hip stretch. So you're going to feel that in the groin area, in that inner thigh area, and then you can switch sides. You're going to feel it on the leg that stays straight. All right, so just gentle stretching, nice and easy. Like I said, you can prop this foot up on a stool if you want to keep that stretch going, or to get a little bit better stretch, but just watch really like this whole bending over and twisting and things like that. Everything should stay very much forward, and you should feel a good stretch. If that is painful or that sends any sort of numbness and tingling or uncomfortableness in your knee or ankle, you obviously don't want to do that stretch. The next one, what I'm going to do is I'm going to show you which is in kneeling. And this can be very difficult on the knees, so you can place a pillow underneath both knees if it's really too uncomfortable, or if you just can't kneel, then don't worry about it. So what you're going to do, and with any stretch, you want to do this both sides. So I'm going to demonstrate one side, but you always want to make sure that you do both sides, regardless if it's just one hip that hurts. Everything's connected, and that makes it a little bit difficult to treat at times, and it makes it more important that you stretch both sides so you're getting both sides equally stretched out. So you're going to come down onto one knee. You're going to put your leg where your ankle is directly underneath your knee, and you're going to lean forward. Now you want to keep your back straight. You don't want to be down here like this. You want to keep your back nice and straight, and you want to bend into this front knee. You should feel a stretch coming in front, right in this hip flexor area. Again, you don't want to rotate. You don't want to rotate. If you start to rotate your hips or your shoulders, you're going to not feel as good of a stretch. So just nice and easy, come forward. You'll feel a nice gentle stretch in there. You can bend as far forward as you would like. Just getting that stretch in there. But again, you don't want pain, you don't want numbness and tingling. You want to get that nice stretch. And then you can go ahead and switch legs. Finally, what you want to do is you want to do our figure 4 stretch, which you've seen in other videos where it's laying down. If you haven't seen our other videos, all you have to do is go to our YouTube channel, Total Performance Physical Therapy. We have a bunch of those. But you can sit in the chair and cross your right or left ankle over your right knee. Sit up nice and straight. Now, if you feel a stretch here, then that's okay. That's enough. Some people have a hard time even just getting their leg up onto their knee. Stop wherever you feel that gentle stretch. Again, don't push it. So if you sit up nice and straight and you have a stretch and you feel it here, that's okay. Now, if you're sitting here like this and you don't feel a stretch, you want to go ahead and just lean forward, nice and easy. Now you don't want to bend forward, you don't want to slump forward, you want to come forward as gently as possible. You are going to feel this stretch anywhere from the groin to the back of the knee, to the back of the hip, to the back of the leg, depending on where you're tight. So don't expect this to just be all in the butt. This is targeting that hip area, but you may feel this in other places depending on where you're tight. So don't expect this to have any sort of particular spot in the hip that you can feel it, especially if you're tight other places. If you or someone you know is suffering from hip pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good day.